Thank you very much for chatting with us today after Cornwall and Isles of Scilly's Integrated Care Board meeting. Could you tell us your name and role on the board, please?
I'm San Trikanthan, I'm Vice Chair of the Integrated Care Board, and I also chair something called the Finance, Performance and Commissioning Committee.
Brilliant stuff. And you've been involved on the board for how long?
2 years since its creation, so it's really exciting to reach this milestone and to reflect back on what we've achieved and what we still need to do for Cornwall and Isles of Scilly.
And what would you say you're most proud of seeing the board deliver over those 2 years?
Well, I think working together as a system is really important. So what does that mean? It's primary care, it's our hospitals, dentists, pharmacists, etc., all of which is about serving people in Cornwall and the Isles of Scilly as best we can. And that's come together really well, and we've been able to achieve a great deal together by working in that way.
And obviously we are here in lovely sunny St Austell and the weather's looking nice for summer. We're getting ready to have quite a busy summer period of lots of visitors, and at every board we hear about our performance. What's it looking like now across Cornwall and the Isles of Scilly?
Well, we've come out of a very busy winter and we're starting to see improvements in performance in terms of how long it takes to get a GP appointment or ambulance availability, but there's still a lot to do. And one of the concerns, of course, with the summer is with so many people coming, it puts extra demand on our services. So our ask is very much about people trying to be safe, do the right things in terms of prevention, whether it's sun cream or whether it's your dental needs, and making sure those are sorted as early as possible so that we don't put too much pressure on a system that is trying its best.
And that's why we actually have a summer campaign called Where is Best, aptly named. And of course we've got lots of ways people can access service 24/7. We've got our minor injury units, we've got our emergency dental service which operates, so we'll be promoting that over the summer. But what's really important, and what we do at every board, is hear from people's experiences across the health and care system, and we hear from staff and patients and people alike. And today's films were around the theme of prevention, and that's really important for us because we're getting ready to launch a Healthier Together prevention campaign in a few weeks. What did you think of the films and the stories you heard?
I thought the personal stories were incredibly powerful. It was also great to see the power of the voluntary sector that does so much in terms of prevention. Together, it really tells an important story, which is if you can do more to manage your own health, your exercise, your diet, you are helping the NHS perform that much better, because really treatment should only be a last resort to things that can't be foreseen or things that are beyond our control. So it's great to see the breadth of work and services, over 3,000 local organisations that are doing incredible work to help with prevention and help you in local communities.
And they are our unsung heroes, aren't they? Every day they're going and caring for others, supporting others, delivering services that really boost and help our NHS services.
Absolutely. I work in the charity sector. I visited one local organisation called the Band of Brothers last night that does work to help with men's mental health. And these are unsung heroes working on a voluntary basis. So they make a little money go a really long way. And that's an incredibly powerful story for us to hear at the Integrated Care Board.
Yeah, that sounds great. I'd love to get Band of Brothers involved in a future film, so thanks we'll make sure we get in touch. And of course as well today we were hearing around two important issues. One was dentistry and one was general practice. And of course we're looking to have a new strategy come back to future meetings, both on dentistry but also on primary care. But just talking about dentistry, people are really unsatisfied, aren't they, at the moment? And it's not just a challenge unique to Cornwall, it is a national issue, and that is around a shortage or challenges in accessing NHS dental care. What do you think we need to be looking at, and what was discussed and the key points that come from today's discussion?
Well, it's three things. I think firstly, prevention, and a really sizable programme, particularly focusing on children to improve oral hygiene and health before it becomes a critical issue. So we've got to do the prevention. The second thing is we know that there is a big waiting list for NHS appointments in Cornwall and Isles of Scilly, and we're doing our best to clear that backlog, but that is going to take time. And the third thing that we're trying to do to stabilise is stabilisation appointments, which give people emergency appointments on the NHS to deal with urgent oral health issues while they're waiting for an NHS dentist. So it's not perfect, but it is definitely addressing the issues that many people, including myself, are facing in terms of access to dental appointments in Cornwall and Isles of Scilly.
And I think it's really important that some of that work's already underway, isn't it? We heard about dental school programmes, so teeth brushing advice and kits being given out to local primary school age. and loads of other schemes to help people with learning disabilities to access dental appointments if they need to. And of course, we do have our emergency dental service, which is open to anybody who isn't registered with a dentist to use. And so we'll be promoting a lot more over the summer. And importantly, it's about attracting dentists to come into Cornwall and Isles, like we want across all of our NHS staff areas. And going forward, I think that's going to be an exciting area of growth and development and innovation to improve dental access for Cornwall.
Absolutely. I think that last point about attracting dentists to come and work in Cornwall and Isles of Scilly is really important. I say that as someone who moved here a few years ago and wouldn't ever think about leaving, because it really is a great standard of life outside of work, and it's a great community to work with. And I think we've seen that in some of the satisfaction surveys we've seen about primary care, including dental.
Yeah, and of course we also talked about general practice, so that covers the surgery, the GP surgery services that people receive. Of course, primary care is wider, covering a lot more than just what you get for your GP surgery. But important today as well, interestingly, the national statistics for GP satisfactions were published, and Cornwall's figures look good compared to the national average. But there is a lot more to do. We know people feel frustrated. What was the sort of primary focus of the general practice paper that was discussed at board?
Well, it's really a paper in a wider strategy here in Cornwall and Isles of Scilly to move care to place. So what does that mean? It's moving care out of hospitals and, where possible, closer to where you live. That's all about primary care. It's about the voluntary sector. It's about much of what we've talked about in this conversation. And we believe that can deliver better value for money, better productivity, and also it's easier for you as someone living here to access that care. So that's going to be the shift you're going to be seeing. And this paper was the start of that conversation that will continue not just this year, but in the next couple of years. And hopefully that transformation will be seen by people.
And of course, the biggest aim out of that is improving GP access. Interestingly, some of the figures in the paper reveal that actually Cornwall has the highest level of GP appointments per population across the country. So we are actually supporting our people to see their GP appointment, and we've got really high levels of missed appointments. So it is a two-way street, isn't it? If we want to improve access, we need everyone to play the part in making sure they're keeping their appointments or cancelling if they don't need to. And obviously, there's maybe frustrations around why people cancel appointments. I know there's a lot of people who have work commitments, caring commitments, and even affordability of being able to ring up your GP or even get the bus can lead to people cancelling. So it's about understanding, well, how can we make it easier for people if they can't access, but also how do we make it easier if they need to access as well?
Absolutely. So more GP appointments is absolutely critical. The bit we can do, of course, is not missing our appointments, because the knock-on effect is a delay for other people. So that's also important. We also have to recognise that there's an ageing population here in Cornwall and Isles of Scilly. So demand for GP services is going to go up. So part of our strategy is also building in the increased number of appointments to plan for a changing population in the years and decades to come. So all of that needs to be factored in to our strategy.
And just before we filmed this clip, we've been talking and meeting lots of new people at the ICB. We've had new board members join us, and we've had our reappointing board members. So it's quite a nice moment today in our second year to really reflect on going forward. What are you most looking forward to for us achieving in the next sort of few years?
Well, I think the number one thing for us is recognising, with the money we have, how do we make it go further? And I really believe we have to have a focus on place-based care. So care closer to where you live, in community hubs, in GP surgeries, improved dental access, pharmacy, etc. So I think that's really exciting. And I know everyone, including the new people who've joined us today, as well as those who've been on the Integrated Care Board for the last 2 years, are really equally excited about it. So having that focus and then delivering a plan and sharing it with everyone is what our priority will be.
And that's really important, to really focus on caring where it matters. Thank you for your time.
Thank you.